Hi, I'm Dr. Teresa Caraway.
And I'm Dr. Jace Wolfe. We're with Hearing First. Today, we're going to visit some common statements that are made about children with hearing loss. And we're going to try to tell you what's true and what's false. Are you ready to do a little myth busting?
I'm ready. Let's do it.
Let's go. In actuality, if you get your hearing technology early, wear it during all waking hours, and are exposed to a language-rich listening environment, we expect children with hearing loss to develop typical listening and spoken language skills.
Go ahead.
No, this is
we
you.
Both like this one because we want those newborns from day one to start experiencing books and having being read aloud to. So that's what's important. Day one, you begin. Read aloud.
Without a doubt. You're stimulating those auditory areas of the brain, and I promise you that can be really one of the more precious moments that you share with your child from day one.
Absolutely.
That is true. That is very true. We all have different hearing abilities and communication abilities. Children can be born with different types of hearing loss, conductive, sensory neural, or mixed, and they can also be born with different levels or degrees of hearing loss, different levels of severity. And hearing loss can be even different between the two ears. You can even have normal hearing on one side and hearing loss on the other, or you can have hearing loss in both ears, but there can be differences in the level and the type of hearing loss between the two ears.
Mm-hmm. Oh, absolutely. You know, what's good for a baby is good for a baby. But if you happen to have a hearing loss, then there's some special strategies and techniques that really put the emphasis on learning spoken language through listening.
No way. If your child appears to be getting fussy or tired when they're using their hearing aids or cochlear implants, it's best to keep their hearing technology on their ears, but try to take a listening break. Move away from the noisy or the chaotic situation for a bit. Let them recover, but keep those hearing devices on their ears. Eyes open, ears on. Absolutely false. There's a ton of research that shows the more you use your hearing aids or cochlear implants, the better your speech and language abilities.
Absolutely. And early on with little bitty babies, or when babies start wanting to pull their hearing aids off, sometimes that perseverance always pays off for families to persevere to keep the hearing aids on all waking hour.
Couple of simple rules. One that's easy to remember: eyes open, ears on. Another, the research shows that we really need to aim for 10 hours of hearing technology use a day at least. So remember, 10 to win. That would be false.
That would be false.
And that's not just our opinion. There's plenty of research that shows that when we're developing brains and we're developing listening and spoken language, you need person-to-person human interaction. In fact, listening to words over a device with screen time really provides no benefit to brain development or speech and language development.
There is no app like your lap.
That's right. I love it. Well, that was fun.
Yep.
Hopefully we busted a few myths, and hopefully you learned a little bit about what it means to optimize the listening and spoken language outcomes of children with hearing loss.
Wherever you are on this journey, or however you may be feeling, Hearing First is here to support you every step of the way. We want to encourage and empower you as your child learns to listen, talk, read, and thrive just like kids with typical hearing. Subscribe to the YouTube channel and join our Facebook group. And be sure and visit hearingfirst.org.